How can you maximize the results while minimizing the cost of the service sold? That's what we're going to talk about today. So I have patients coming in all the time, and they have, I don't like my nasolabial folds. I don't like my under eye bags. I don't like my cheekbones. I don't like my lips. I don't like all these lines. I don't like. And then you're looking at them, and oh, by the way, I'm on a $700 budget. And you're looking at them going, okay, how am I going to address all these different concerns and minimize the cost? That's where combo treatments come in. That's where utilizing filler with tox can really lower the cost to the patient, but give them the results they want. So first thing that comes to mind, let's say somebody comes in, they've got some nasolabial folds maybe, but they're not too bad. Maybe the cheeks are a little soft, and maybe you're looking at, they've got some pre-jowling going on down here. And you know, they've talked to you about all this. What I do for that, if they're on a, I mean, the obvious solution would be, hey, let's put filler in all these areas and, you know, plump it up and make it look a little bit better, right? But if you're on a budget, filler's kind of expensive. You know, I charge anywhere from, you know, $600 to $800 for filler, depending on the area I go into and the product that I'm using. So literally today, I had a patient come in with that exact scenario, and she wanted a lower cost treatment. So what did I offer her? I said, we're going to start you off with a Nefertiti lift. Nefertiti lift is we do a little tox in the platysma muscle right here on the jawline, relax the depressor, let the levitators take over, and watch what happens. Then in 2 weeks, I want you to come back. I'm going to reassess you. And if we didn't get quite the results we want, then I'll add a little filler to the areas. And I'll be able to add a lot less filler because of that lift. And 9 times out of 10, the Nefertiti lift alone's enough to soften everything up to where they're happy. And if it's not, then I'll add a little bit of filler down the road and save the patient money. Now, Nefertiti lift you have to do every 3 months. That's okay. It's a fairly inexpensive treatment, you know, less than $200 just to do the Nefertiti lift versus $800 for jawline filler. You know, so let's say. So that's an example of combo treatment. Another example of combo treatment, and I do this one all the time. They come in with nasolabial fold problems or big bags underneath the eyes that they don't like. So instead of putting filler to fix that problem, I'll look at them and go, hey, maybe we can put filler on the cheeks, inflate the cheeks, tug back a little bit, soften the lines underneath the eyes, and maybe I can get all 3 of those with one treatment. All right. So it's not a combo treatment, but it's one treatment doing a combination of things. And watch what happens when you give them cheeks. The shadows disappear. The light is differently. The lines under the eyes don't seem as bad. All of those things with one vial of syringe of filler, or maybe 2. And so just think outside of the box. Hey, how can I use the tools in my toolbox to give them the treatment they want without busting their budget? So those are a couple of tips and tricks I do in my practice. Hope you learned a couple of things. Now go try it on your own.